Well, hello. It's Bruce Williams again. And it's Friday, so it's time for Gross Path Challenge number 47, which we're going to give in a multiple choice format, similar to that preferred by the American College of Veterinary Pathologists. As I do at the beginning of all of my lectures and quizzes, I want to thank my friends and colleagues who over the years have provided me images, which I can use in these lectures and gross exams. So, get out a piece of paper and a pen, because you're going to want to jot down some of these multiple choice answers. And we'll start with slide number 1, which is tissue from a horse. Which of the following is true regarding this disease in horses that are older than 15 years of age? Answer A. Colic was the most common reason for euthanasia in this subset of animals. B. Pituitary pars intermedia dysfunction was the most common reason for euthanasia in this subset of animals. C. Over 75% of animals in this study were affected with this disease. Or D. Thyroid adenoma was the most common coexistent neoplasm in this subset. Think about that, and I'll be right back with the answer. Okay, time's up. This is a tricky question. It's one of the reasons I don't like multiple choice questions. The answers were all chosen from a 2016 article, a fantastic article by Peg Miller in VetPath called What's New in Old Horses? Postmortem Diagnoses in Mature and Aged Equids. The correct answer was D. Thyroid adenoma was the most common coexistent neoplasm in the subset. We see, not as commonly as we see tumors of the pars intermedia in horses, we see a lot of thyroid adenomas. The literature says that mostly thyroid follicular. My experience, now that we have immuno, is that we see more C-cell tumors on balance than follicular adenomas, but that might change in different parts of the country. Okay, the wrong or incorrect answers, the foils, are A, colic was the most reason for euthanasia in this subset of animals. Actually, colic was third after old age, in quotes, and traumatic injury. That also answers the question, pituitary pars intermedia dysfunction was the most common reason for euthanasia in this subset. It was the most common specific diagnosis, but not the most common reason for euthanasia. Okay, foil number C was over 75% of animals in the study were affected with this disease. No, it's much less actually than that. 65 out of 245 were affected, so it's around 25 to 30%. Okay, not crazy about that particular question. It just sorts out some of the data from the abstract. I think if you know about pars intermediate dysfunction, you need to know it's seen with higher predilection in ponies. A lot of these animals develop laminitis. They may be associated with metabolic syndrome. All of these are very important, including the clinical pathology of this particular disease. Not a big fan of just sorting through questions, but sometimes that's the way it's done. Okay, get off my soapbox and go on to number 2, Dr. Williams. This is tissue from a rat. Name the most likely agent. A. Nipostrongylus species. B. Oxyurus species. C. Cephacia species. Or D. Rodentolepis species. Once again, name the most likely agent. Nipostrongylus, Oxyurus, Cephacia, or Rodentolepis. Okay, time's up. This one is straight out of Percy and Barthold. This particular entity is pretty much always covered if you come to the gross course or the polar course in the lectures on rats and mice. The correct answer is C, Cephacia species. Cephacia and Aspiculurus are two common genera of pinworms in rats that you will see in the large colon and the rectum. let's look at the incorrect answers. Nipostrongylus strongyles in rats and mice and other rodents often live in the lungs. Oxyurus, and that's a good one for other species. Oxyurus equi, oxyurids in primates, but not in rats. Wrong genus. And Rodentolepus are seen in mice and live in the small intestine. And those are cestodes. Okay, moving on to slide number 3. Slide number 3 is tissue from a horse. What is the most likely cause? Answer A, bovine papillomavirus 1, 2, and 5. Answer B, Equus caballus papillomavirus 3, 4, and 6. C, Trichophyton equinum. Or D, Dermatophilus congolensis. Once again, what's the most likely cause? Bovine papillomavirus 1, 2, and 5. B, equine caballus papillomavirus 3, 4, and 6. C, Trichophyton equinum. Or D, Dermatophilus congolensis. Okay, time's it. I seem to ask this question a lot because I got lots of pictures of it. And it's pretty common if you work with horses for a living. I saw quite a lot of it when I was working with horses on some of my early military assignments. Okay, these are known as oral plaques, and they are non-transmissible from horse to horse. They're spread by biting flies, which is why they're usually on the ears. Diseases that are spread by biting flies often go after the ears of dogs and horses and whatever they're spreading. And it's caused by an equine papillomavirus. The correct answer is Equus caballus papillomavirus 3, 4, and 6. Don't forget, Equus caballus papillomavirus number 2 has been associated with squamous cell carcinoma formation on the genital and perigenital areas of horses. So that's another important one to know. Equus caballus papillomavirus 1 will cause small papillomas on the nose, possibly within the mouth. Okay, what are our incorrect answers? A, bovine papillomavirus 1, 2, and 5. Well, 1 and 2 are the cause of sarcoids. This isn't a sarcoid. These are oral plaques. C, Trichophyton equinum, is a common dermatophyte of horses. You often may see it around the face and the neck due to contaminated tack, and it will be flat areas with a hyperkeratotic crust. These are actually raised white areas that are very hard to the touch, much harder than the surrounding ear tissue. And D, Dermatophilus congolensis, certainly you can see that in horses. It's pretty common. It's called rain rot. That is a very superficial bacterial infection, largely of the epidermis, which is very exudative. It has pustules. It gloms all the hair together, sort of looking like little painter's brushes, and it's caused by a bacterium which is very hardy in the environment, forms zoospores, which under the right conditions in the skin will proliferate, forming little railroad tracks, very common in horses. So these are oral plaques, Equus caballus 3, 4, or 6. Okay, slide number 4. This is tissue from a red Angus calf. Which of the following genes, let me restate that, mutation of which of the following genes is the most likely cause? A, SLC4A2. B, fibroblast growth factor 4. C, agrican. Or D, cholia 1 and cholia 2. Let's go through them again. A, SLC4A2. B, fibroblast growth factor 4. C, agrican. Or D, cholia 1 and cholia 2. Okay, the correct answer here is the SLC4A2 gene. This disease has been described. This is osteopetrosis. This is from a calf. It's the genetic mutation has been identified in red Angus calves. We see this in a number of other breeds. This animal has a defect in remodeling, the primary spongiosis. So you end up with these two long pyramids of bone, very characteristic of osteopetrosis. The bones do not grow properly, so they're foreshortened. The animal's teeth don't erupt because the jaws of the mandible are also almost solid like this. Very little bone marrow is able to be put down in here. So these animals don't survive very long after birth. The disease was largely described by Dr. Donald O'Toole from the Wyoming State Veterinary Diagnostic Laboratory in the red Angus. Okay, let's look at our incorrect answers. Fibroblast growth factor 4. We know fibroblast growth factor 3, it causes spider lamb disease. Fibroblast growth factor 4 is one of the genes that is involved in the osteochondrodystrophies that make basset hounds and dachshunds have long bodies and foreshortened legs. Aggrecan is a gene that goes to formation of proper cartilage, and aggrecan mutations have been identified in animals with osteochondritis dissecans. Cholia A1 and Cholia A2 have been associated with osteogenesis imperfecta. You got to know your genetic mutations now. I've always said it's all in the genes, and now we're starting to figure it all out now that we have the genome on so many animal species. So knowing what gene mutation causes what disease is going to be more and more important as time goes by. Okay, let's move on to number 5. We got a couple of non-human primate slides coming up. I just got back from Gainesville, delivered a lecture to a very enthusiastic or maybe desperate crowd in Gainesville, Florida, because over half of them are taking the ACVP exam in a little over 2 weeks now. So, slide number 5 is tissue from a rhesus macaque. What is the most likely cause? A. Macacine herpes virus 1. B. Macacine rhodinovirus. C. Rhesus cytomegalovirus. Or D. Simian varicella virus. Okay, Macacine herpes virus type 1, Macacine rhodinovirus, Rhesus cytomegalovirus, or Simian varicella virus. Okay, the correct answer is C, Rhesus cytomegalovirus. Okay, talk just a little bit about cytomegaloviruses. You only see it in animals who are severely immunosuppressed because normally our cell-mediated immunity keeps it in check. You can see it rarely in the normal animal in some secretory glands like the salivary gland, usually never pokes its head up. We all have it, and it's only when our lymphocytes, especially T lymphocytes, are wiped out that you are going to see it. It often causes vasculitis and necrosis, which is surrounded by neutrophils, because essentially that's all these immunosuppressed animals have to fight it with. And in the intestine, it looks like this. People call these pseudo tumors. They're raised areas of necrosuppurative inflammation of the mucosa. Intestinal pseudo tumors, and they're caused by cytomegalovirus infection. The cytomegalovirus infection in these animals also will cause vasculitis in the central nervous system, necrosis in the lung, and will affect the testis as well as common sites, but you can see it just about anywhere. Okay, let's look at our incorrect answers. A, Macacine herpes virus type 1. This is Macacine. This is also known as herpes B, very important disease of Asian macaques. They carry it. They don't cause much of a problem. Sometimes you'll get oral and genital ulcers. Rarely in immunosuppressed animals, you'll get disseminated necrosis in multiple organs, but you don't get these big red flaming areas in the intestine. You get little white dots of necrosis in the liver, spleen, adrenal, and other organs. B was Macacine rhodinovirus. That by itself doesn't do much. The gamma herpes viruses don't do much. But when it's combined with immunosuppression, usually simian retrovirus type 2 is involved in these animals. It is the virus that causes retroperitoneal fibromatosis. It's also known as retroperitoneal fibromatosis associated herpes virus, only in immunosuppressed animals, and then they'll get that particular condition. Finally, D, simian varicella virus, usually simian herpes virus or cebid herpes virus type 9. Occasionally 6 and 7 get involved, but that is a varicella virus. That's one of the genuses of the alpha herpes viruses, and that is closely related to chickenpox. You can't tell the difference between chickenpox and simian varicella virus. It causes a blistering vesicular rash to start with, which is intensely pruritic, and in some animals will cause disseminated necrosis in multiple organs and death. You see these big red lesions in the intestine, you think rhesus, cytomegalovirus, and immunosuppression. One more hint for those of you who are taking the exam. If you ever see cytomegalovirus in a histologic slide, I want you to think of immunosuppression and look for other agents. A great slide that I've used many times in tests over the years is a lung of a rhesus macaque, which has gigantic cytomegaloviruses, and that's a big red flashing sign that I'm going to look for more. That animal also generally has pneumocystis, as well as giant cell pneumonia from SIV. It's a great threefer, which I've used over the years, and it teaches a very valuable lesson. Cytomegalovirus inclusions, you got to keep looking for more things. Okay, slide number 6 is a classic, and this is from a squirrel monkey. And all I want is the most likely cause. A, vitamin D deficiency. B, vitamin C deficiency. C, Semerid herpes virus type 2. Or D, vitamin A toxicosis. Once again, vitamin D deficiency, vitamin C deficiency, Semerid herpes virus type 2, or vitamin A toxicosis. Okay, time's up. You can look this one up in Mansfield's Volume 2 of Non-Human Primates in Biological Research. It is a classic. The correct answer is vitamin C deficiency. Vitamin C deficiency is an essential cofactor of two enzymes called lysyl and proline hydroxylase, which are important in the formation of type 1 and type 4 collagen. Type 1 collagen being the most common collagen in the bones, the joints, around the teeth. And then type 4 is the primary collagen in the basement membranes of blood vessels. So these animals tend to hemorrhage if they are deficient in it. And their teeth will get loose and all sorts of things. Well, what happens in these squirrel monkeys, and it's only in squirrel monkeys, and I've got no idea why it's only in squirrel monkeys, but they will hemorrhage over the top of their skull. I think it's because when no one's looking, they whack each other over the head with like the Three Stooges. But they do hemorrhage over the skull, and then when you reestablish the normal vitamin C, a lot of times it will ossify around the outside. So it becomes almost a permanent, it remodels over time, it becomes almost a permanent feature of these animals. They're known as cephalohematomas. So the correct answer is vitamin C, scurvy. Let's look at the incorrect answers. Vitamin D deficiency is well known in New World primates. It causes a disease that goes by many names, simian bone disease or metabolic bone disease. And the problem is that New World monkeys require vitamin D3. The activated form of vitamin D is 1,25 dihydrocholecalciferol, and you have to have vitamin D to make that. Vitamin D is the gatekeeper for the absorption of calcium and phosphorus through the intestine. And so what happens is if you don't have vitamin D3, you can give them all the D2 you want. It's not going to make any difference. Without D3, they can't absorb calcium. They start to resorb it from their bones. Their bones become very rubbery or brittle. And so they have deformities. If they're growing, the deformities will affect the growth plates. They'll get rickets. If they're older animals, they'll get a disease, which you can call fibrous osteodystrophy or osteomalacia. But once again, their bones become very rubbery, soft, because there's not a lot of calcium, and they break very easily. The incorrect foil number 3 was Semerid herpes virus 2. 2 reasons that's wrong. First reason is that squirrel monkeys carry it. They give it to other New World monkeys like Ao's monkeys or tamarins or marmosets. They don't show any diseases. The second reason is that causes lymphoma and it'd be very unusual to have lymphoma on top of the head. You would look at the lymph nodes or something like that, and you still would have to look at another species of New World primate. And D, vitamin A toxicosis causes a lot of problems in a lot of species, including cats and cattle, lions, and all sorts of things. But I don't know of any disease it causes in non-human primates. Probably would, but it's certainly not a natural, spontaneous, or commonly encountered disease in the laboratory. Okay, one more non-human primate, if you can take it. And you can take my long-winded explanations. Slide number 7 is tissue, once again from rhesus macaque. What is the most likely diagnosis? Your choices are A, fatal fasting syndrome, B, arenavirus infection, C, flavivirus infection, or D, amyloidosis. Once again, fatal fasting syndrome, arenavirus infection, flavivirus infection, or amyloidosis. Okay, time is up, and the correct answer is D, amyloidosis. When you look at the livers of rhesus monkeys, they're big, the edges are rounded, you've got two major choices. It's either fatty liver or it's amyloid, and you just have to think how hard this liver is going to be. Can you pick it up and whack somebody in the head, knock them out? It's probably amyloid, and that's what I see when I look at this particular liver. It's amazing. Rhesus monkeys, ducks, and horses can put so much amyloid down the liver that the hepatocytes are just tiny little strips, incredible atrophy. They're amazing as to how much amyloid they'll put down. When you see amyloid in the liver of the monkey, first place you want to go is the small intestine. You usually find it in the lamina propria, also in the spleen, lymph nodes, and adrenal gland. But small intestine actually in affected animals is the number one most common place to find it. Okay, now if this was yellow and it looked gushy and you thought it was fat, then A, fatal fasting syndrome would be a very good choice. Fatal fasting syndrome happens in obese monkeys, often females, during times of extreme stress, as in changes in social groups, maybe pregnancy and dystocia, or concurrent disease. And they mobilize tremendous amounts of fat to the liver, the kidney, the adrenal gland, and you will see just tremendous fat atrophy in the abdomen and the skin, and everything's gone to the liver. A similar appearance of a very fatty liver would be seen with the incorrect answer C, flavivirus, which is yellow fever, which affects primates, especially non-human primates and people. It's a mosquito-borne virus which causes tremendous damage to the liver, a lot of necrosis, but it's primary mid-zonal, and the rest of the liver, because it's sick, it accumulates fat. Sick hepatocytes can take fat in. It doesn't cost any energy, but it takes energy to push it back out, so it tends to accumulate. Sick hepatocytes often have fat in them in any species, so whenever I see a lot of fat in the liver, I know that liver is pretty sick. And then finally, incorrect answer B, arenavirus infection. That will cause liver damage in New World primates. It's known as calcitrichid hepatitis. It's the same virus that causes lymphocytic chorioal meningitis. And New World monkeys will get it from rodents. It used to be that we would feed them pinky mice, and the pinky mice weren't being screened for this virus. So we had outbreaks all over the world. It's very rare right now. It usually comes in from wild rodents that the animals have access to. But it causes hepatic necrosis in other organs as well, including the small intestine and adrenal glands, and ultimately the animals have bleeding tendencies because they go into liver failure. So, correct answer, it's a hard-looking liver, and this is amyloidosis. Would you like to get away from non-human primates? I would. This is tissue from a suckling calf. Which of the following are the least likely to demonstrate significant lesions? Remember, we're looking at the next four of the least likely to demonstrate significant lesions. A, the intercostal muscles. B, the diaphragm. C, the tongue and neck muscles. And D, the quadriceps muscles. This is from Jubb and Kennedy, Volume 1. Okay, Time's up. We're looking at the heart of a suckling calf. There's tremendous pale areas within the myocardium. This is classic white muscle disease. You would see a combination. It's a polyphasic disease in the muscle, so you're going to see a combination of degeneration, necrosis, fibrosis, and mineralization all at the same time, okay, because it's been going on for a while. Now, the lesions of white muscle disease, a disease which is a result of vitamin E selenium imbalance, is going to affect the muscles that the calf uses on a regular basis. And little calves aren't doing a lot. They're laying around, they're nursing. They're not getting up, they're not running around, they're not athletes. Okay, so if we look at the muscles, which are the ones that they're using the least? The quadricep muscles, D, are the probably least used in this animal, so they would have the least significant lesions. Look at the other ones. A, the intercostal muscles. These animals have to breathe. They're going in and out many times a minute, so they're being used. They're going to be damaged. The diaphragm needs it to breathe. It's going to be damaged. C, the tongue and neck muscles. Probably the most likely to be damaged because this is the one the animal sticks its head up, it bumps its mother's udder to nurse, and that nurses and swallows. And so the tongue and neck muscles probably going to have the most significant lesions and a great place to look for lesions in white muscle disease. Quadricep muscles, not so much. You'll find them. You'll find some scattered necrosis in there, but not great lesions like you'll see in the other muscle groups. So that's from Jubb and Kennedy. Slide number 9 is tissue from a growing chicken. Which of the following is not, I repeat, not a cause of this lesion? A, calcium deficiency. B, phosphorus deficiency. C, vitamin D deficiency. Or D, dietary phosphorus excess. Once again, which is not a cause of this lesion? A, calcium deficiency. B, phosphorus deficiency. C, vitamin D deficiency. Or D, phosphorus excess. Okay, this is one straight out of Avian Disease Manual, pages 188 to 189. And this is a classic case of rickets in a growing bird. If it was an old bird, you might see fractures. But we're looking at the ricketic rosary, or the large costochondral junction. It's a classic lesion of rickets. And chickens and poultry are somewhat unusual in that you can have deficiencies of calcium, phosphorus, and vitamin D that all cause this. Most other animal species, it's usually vitamin D deficiency or phosphorus deficiency, but the body has enough calcium to supply the needs. So calcium deficiency in the diet usually isn't a cause of this. Okay, but in chickens, all three will cause it. The only thing that would not cause it would be an excess of phosphorus in the diet. Okay, if you have too much phosphorus in the blood, you may see a decrease in calcium, but in the diet, not so much. Okay, and our last slide, slide number 10, is tissue from a mouse. Which of the following is the most likely diagnosis? This one, once again, straight out of Percy and Barthold, page 96, if you're looking it up. And your choices are A, acariasis, or mites. B, ectromelia. C, alopecia of B6 mice. Or D, alopecia areata. Once again, your choices: acariasis, ectromelia, alopecia of B6 mice, or D, alopecia areata. Okay, time's up. The correct answer is alopecia of B6 mice. Okay, this is a common problem in B6 mice. It's intensely pruritic. So this animal just scratches and scratches and scratches. A number of things have been reported, including dietary vitamin A deficiency, mites, genetics. Obviously, it affects these B6 mice. Remember, B6 mice are black. So I didn't say black B6 mice, I just said B6 mice. You sort of need to know before you go in there which mice are white and which mice are black. C57s are black, B6s are black. A lot of the other ones are white. but this is very specific to this particular strain of mouse. The incorrect answers: acariasis. It's not your typical mite lesion. Your typical mite lesion might be ulcers or small ulcers of the skin around the ears, between the shoulder blades, but not these big areas of severe pruritus. You probably flip this animal over, you're going to see the same on the other side. It generally affects the flanks and some part of the dorsum. B, ectromelia. Ectromelia is mouse pox. It's a devastating disease, but that causes gangrene and loss of the limbs and the tail. So not a good choice for that. And D, alopecia areata. That's pretty bland, hair falling out type of baldness, and we see it in a number of inbred strains of animals, but once again, doesn't have the pruritic nature that this particular lesion does. Okay, I want to make sure. I think I might not have given you all of the sources for these. Let me go back and make sure that I repeat them. This particular one was from Peg Miller's article, 2006, What's New in Old Horses. This one, straight out of Percy and Barthold again, page 504, if you want to look that one up. This particular one, straight out of Jubb and Kennedy, volume 1, page 500. Another Jubb and Kennedy here, volume 1, pages 50 to 52. I think I mentioned this one. This is Mansfield's book on non-human primates and biological research, volume 2, pages 19 through 29. Covers the herpes viruses in macaques. Also, Mansfield's book, volume 2, page 660 to 661. We'll cover this for you. Mansfield's book, pages 612 to 614. And there was a good article a number of years ago in VetPath in lesions of aging macaques. You might want to look that up. It has a lot of good ones. Covers amyloidosis, which was one of the most common lesions in that. Back to Jubb and Kennedy, volume 1, pages 214 to 216. Avian Disease Manual, as I mentioned. And finally, Percy and Barthold. This one was pretty heavy on the textbooks here. So from your reading list, Jubb and Kennedy, Mansfield's Volume 2 of Non-Human Primates are books that you should be familiar with. Okay, well, thank you for hanging in there. We'll have another Gross Path Challenge next week. And I hope everyone has a great weekend. And I'll see you next time.